I have a 4-year-old son named Nolan. He's the most incredible little boy. And Nolan, when he was 6 months old, he was diagnosed with a neuromuscular condition called SMA, spinal muscular atrophy. And Nolan has the most severe type. So Nolan has type 1. That comes with some pretty severe physical limitations.
When we first learned of his diagnosis, we were told that most children with the condition don't make it past 2 years old. They tend to degrade, they lose their respiratory functions, along with their motor functions, of course.
So day to day, I think there's a couple areas of challenge. One area of challenge would be physical mobility. So Nolan doesn't walk.
Respiratory is the biggest one, I think, because he does require ventilation overnight. He requires a lot of suction to maintain his airway. He has a tracheostomy, so there's a lot of care involved with that as well.
And then he also uses a feeding tube so that he can eat safely, and we don't have to worry about him gagging or coughing, which causes vomiting and can also potentially cause pneumonia, which is very threatening for him. Nolan started a treatment called Risdiplam in August 2020. It's administered through his feeding tube or orally if a child can swallow. The specialist thought that it might have a global impact on Nolan's body and could have a positive impact on his breathing, swallowing, and core muscles.
And since then, he has just blossomed into a whole new kid. His hand-eye coordination, his ability to stack, his ability to sort, play with tiny little toys, to do crafting, just things that never ever would have been on the table before are now in play.
He can sit up now independently. He is managing his secretions better. We've seen small glimpses of him swallowing better and using his tongue, which has allowed him to make more vocalizations and more sounds.
Ready for 1, 2, go!
We also seen a lot more head control. So Nolan's able to hold his head up and prone, turn it side to side, things that we'd never ever seen him do before.
Nolan's respiratory function has improved quite a lot. His ventilator settings have been stepped down to almost as low as they'll go. So we're trying to get to the point where we can get him decannulated, which means to remove his trach and be done with that. He's doing incredible things that nobody expected.
Nolan right now is doing so much better than he ever has before. We're looking forward to a really huge milestone, and that's him starting school in the fall. With this treatment, I feel like we've really turned a corner. We're a family with a kid with a complex medical condition, but we're a family that's moving forward and looking to those new milestones like going to school.
I just think once he gets to school and shows everybody what he can do, I think he's capable of some big things. So yeah, there's a lot to look forward to.